The state of Texas reports 500,000 people have lost their Medicaid coverage since April. That's when automatic Medicaid renewals initially were set up during the pandemic ended and people had to reapply.
But many ignored notifications from the state or did not reestablish their eligibility. Joining us now to talk about this huge issue is Palak, who's the Chief Operations Officer for Access Health. Thank you, Palak, for joining us this evening. So which communities are you most concerned about not having coverage?
You know, in Texas, largely folks that have Medicaid are women and children, right? And a few disabled folks. So when we look at communities that we're really concerned about are folks that don't traditionally have access to care. So when we look at certain zip codes in communities, rural communities that don't get the same level of communication, folks that are not used to using technology and social media in the same way. And then there is a lot of misinformation out there too. So I think a lot of immigrant communities are also impacted by it.
And pregnant mothers had continuous Medicaid coverage after childbirth during the pandemic. But in Texas, it now reverts back to ending 12 months after childbirth. So what's the concern here? What's the worry?
I think, like you said, they had continuous. It used to be 2 months. There was a bill passed, and now it's going to be 12 months, later. The biggest concern is making sure people are able to renew their benefits, because if they're not able to renew their benefits, they don't have Medicaid, and that really impedes access to care. So the biggest concern is mainly renewal.
So, Palak, what can people do who've lost coverage now?
People who've lost coverage, please keep an eye and check on your mail. There was a lot of mail that must have come out from the state where they told you potentially that your Medicaid was expiring or needed to be renewed. So if you've received communication, please respond to that communication. You can always go to your Texas benefits and find a way to apply. Health centers such as Access Health, we have outreach and eligibility coordinators, and they can always reach out to us, and we're more than happy to help apply for Medicaid. I also know that if our team works on it, it takes usually 3 to 5 days versus the 2-3 weeks that it takes to get things across done. So knowing that we have certain great resources in the community such as us is really helpful, but everything is available on the state website. We also have a state rep here in the clinic who can help move the process forward. So there's still options, there's still hope, there's still ways to apply. It is just making sure to get all the documents together to make an application.
All right, thank you so much, Palak Jalen with Access Health. And there are several other resources for people who've lost Medicaid coverage, along with detailed information on how to reapply with the state. It's all over at fox26houston.com under Sullivan Smart Sense.